Republican, he did a good job. So basically, the issue is this. The most important factor that all of you know who are teachers or SEIU members is honestly the factor of ventilation. There are many other factors that are important, like yes, kids are not going to keep their masks on. Is there really social distancing of 6 feet? The fact that this is a great opportunity, and I really hope that CTU members can talk about this, of pushing the timeline from 2024 to December 31st, 2021, of having a full-time registered nurse in every school, as well, of course, of LCSWs and other counselors. So if we take the question of ventilation, it is true that CPS, if you drive around the city or you look at your own school, has increased the amount of fresh air coming into buildings. They've put up lots of ducts from the outside, et cetera, but they have refused to allow independent people in, unless that's happened in the last month, and CTU people would know about this, to actually measure whether there are a minimum of 6 what we call fresh air room changes per hour. They say they are, and maybe that's true, but you'd have to measure that. And that's based on cubic feet, not just square feet. There's a lot of other mathematical formulas we don't need to go into. But that's just one of the issues. The other issue, of course, is identification of people who are sick and testing. There is no way schools should reopen if transmission ever gets down below 5%, which is 5% is basically the maximum figure from the World Health Organization, the CDC, that every zip code, not just in Chicago, but in Cook County, should be at. And it's not true now, and it never has been true. As you know better than I do, there are, I don't know how many, but teachers coming from outside Chicago for special positions that they can't fill inside Chicago. So when you look at transmission rates, you have to look at least every zip code in Cook County, including Chicago. You can't go by the citywide average, which is completely distorted because of racist COVID testing. So one thing is the issue of what happens when somebody gets sick, and how do you screen people? So everyone should be tested either by preferably a CDPH tester from the Chicago Department of Public Health, so you don't take up the time of a CPS nurse if there is one in the building. And they should be tested once a week, everyone, period. Everyone entering the building tested once a week. Anything less than that is not good public health practice. Ideally, CPS should have both the rapid test, like the Abbott test that you're probably familiar with. However, as you know, that test has many, particularly false negatives for people who are asymptomatic. So anybody who tests positive on that test in 15 minutes ought to be given a PCR swab up their nose. You may have seen videos of 5- and 6-year-olds, I don't know what school districts they are, who literally are self-taught to swab themselves, which is a much better procedure than making them afraid of a big adult like one of us swabbing them for a PCR test. And certainly anybody who's symptomatic ought to be given both a rapid test, and even if that rapid test is negative, in particular, be given a PCR test on site and get them out of the school as quickly as possible. Don't put them in plastic cages to basically mimic what's going on the border, exchanging plastic for metal. So the question is what to do now. So on Wednesday at 5 o'clock, we're having our regular meeting of the People's Response. We'd love for all of you and anybody else to come. I will put that link into the chat. And we have a very specific proposal, among others, to discuss. And I'd really love to hear from any teacher, staff member, parent, or anyone else in your 11th Ward IPO. I think that schools should not have reopened, period. And for sure, high schools should not reopen at least to fall. So our proposal is to turn every high school into what we call a COVID sanctuary center. As you know, there are 4 high schools for the last month that have been vaccinating teachers and staff. That's good. But we're talking about every single high school, at least, not just doing vaccination, but offering testing, uh, having contact tracers. Uh, any people can be cross-trained to do any of this. Vaccinators are a little more rigorous in terms of the certification, but nursing assistants, medical assistants, it's not just nurses give shots. We have the largest medical campus in the United States. We're 3,000 UIC students. Most of them have volunteered and most of them are not being used. They can be part of this, but primarily that CDPH has to use $180 million it just got to hire people from those communities to be part of these sanctuary centers. These sanctuary centers would also help people with rental assistance, avoid evictions, how to get food, and many other things. So that's our proposal, 12 hours a day, 7 days a week. And I just want to say one last thing, and please take this in the spirit of somebody who was one of the original organizers of SEIU in the 60s and 70s. SEIU, AFSCME, who forced Governor Walker in 1973 to recognize public employees in collective bargaining in the entire state, and also part of AFSCME organizing in the 70s and 80s to get the city to do the same thing, the city of Chicago. Frankly, I think the CTU leadership made a big mistake in two ways with the agreement. One is that they had the vast majority of Black and brown parents on their side if they would have stayed out, understanding it was extremely difficult conditions. It was still illegal because the governor refuses to sign the legislation. But the second mistake, even if everyone agreed to the first agreement, was to unknowingly, in some cases or most cases, have teachers jump to the front of the line in terms of vaccinations. CTU should have said, and still can say, no one is safe till everyone is safe. No one gets vaccinated until everyone gets vaccinated. Those of you who are teachers are sincerely in solidarity with your families, the vast majority of whom qualify as frontline essential workers under phase 1B. Jesse Sharkley and Stacey Gates should have stood up and said, we want every school open as a vaccination center for ourselves, for SEIU members, and for every person in the neighborhood around the school who qualifies under phase 1B. That was a huge mistake. It's something that could be corrected now. Thank you very much.
Thank you, Dr. Ehrman. We really appreciate your insights on this and your perspective as a lifelong organizer and an expert and highly knowledgeable figure on the COVID situation and on everything that goes into community health and public health. So thank you so much for that. Our next panelist will hear from Kenzo Shibata, a CPS teacher, CTU delegate, and the host of the Class Time with Kenzo Shibata podcast, where he interviews organizers, journalists, and leftists across the spectrum on a variety of topics. And Kenzo, please go ahead. Welcome to our panel.
Thank you, Michael, and thank you, Dr. Ehrman. That was great. I'm a high school teacher, so I haven't been called back in yet. Well, actually, I should back up a little bit. I was called in, but it was an error. I put in for an exception so I can do distance teaching in any situation because my wife is immunocompromised and we have a small child. So as much of a pain in the butt as it is to be teaching from home and my son having to learn from home, it really is the only thing that makes any sense at all for my family. It keeps me away from bringing COVID into the home, and it allows me to relieve my wife of some of the home teaching. So I'm running between two classrooms all day. It sucks, but I think that as teachers, as the working class, we're always willing to roll up our sleeves and do what's right for our families and for our communities. But so I guess I want to talk a little bit about the political context of what's happening right now. Because Howard was able to lay out medically why this is a bad idea, and politically, the reason why we're here, I believe, is because one of the things that Joe Biden wanted or demands to have happen is all the schools in the country open within his first 100 days. You don't need to be a doctor to know that, like, that is an arbitrary number. That, you know, this was it's every president does this. And it's their way of, when they're running for reelection, they could say, in my first 100 days, I accomplished these things. And it's not aligned by anything that is pedagogical. You know, none of the teaching doctors are saying there's any reason why we should, you know, have this 100-day, you know, benchmark. So, you know, that is something he hoisted and pushed upon the states. And, you know, we saw through when Obama was president and Arnie Duncan was our Secretary of Education, they always have their ways of twisting the arms of state legislatures to change legislation, change policy, and, like, you know, push Democratic governors to do very right-wing neoliberal kind of stuff. And I see this as being really no different. You know, now the Democratic governors and the Democratic mayors all want to make Joe Biden look good. So regardless, no ideology behind this. It's about Joe Biden wanting to push forward schooling so capitalism doesn't have to come to a crashing halt, which is I think what we really need to do for a few months. But, you know, to let the gears keep moving, businesses keep going. And really, this is a situation where teachers who, for a very long time, we were considered kind of part of the professional class in the world, are being pushed into being frontline workers for the first time. And it's something that I feel like, you know, teachers are just not, we're just not ready for what this means. Like, you know, when we looked at that vote, the vast majority of teachers voted to accept the agreement and to go back in. And I don't think that's because we necessarily think it's the safe thing to do. The conversations I was having with rank and file teachers around this had a lot to do with being afraid that our image in the public would be hurt. I mean, that was a concern we had during the last strike, but we pushed forward because we knew we had momentum on our side. And I think, you know, just a year later from the last strike, a lot of our folks are feeling kind of demoralized, and that influenced the vote. You know, we were punching bags a year ago, and we're tired of being punching bags, and everyone is experiencing trauma from the pandemic. And I think that a lot of teachers and other school workers who voted yes on the agreement were feeling just kind of relenting, you know, just like, okay, fine. You know, there's enough evidence being put out there, you know, even though in our hearts we know it's not, you know, it's being pushed out for nefarious reasons. Um, I feel like people just were like, okay, enough. We can't fight anymore. But, you know, I'm talking my family. You know, my wife is on the local school council of our school. She was on the phone with every parent in my son's class, just having organizing conversations, answering all their questions about the you know, the safety precautions that were being put in. And through those conversations, all but 2 students are doing remote still. So I think, you know, how we're saying this isn't really over. You know, that's another way we could be pushing, you know, the halting of this, you know, reckless reopening of schools is, you know, talking to parents, not being afraid to be political when we have conversations with parents about it too, if they have those political questions. I think that was something that as CTU rank and file members, we've gotten a lot better about doing, but I still hear a lot of hesitance with you know, our members with talking to parents and having political conversations with them. But it's impossible to talk about this because our mayor is a political creature. She's not making these decisions based off of any kind of science. These are political decisions. So unless we're willing to talk politics, you know, we're not going to come to any kind of solutions here. So yeah, thank you all for having me on. And like I said, I have not been called in yet. I know it's going to happen eventually. So I'm, you know, looking forward to hearing what Katie and other folks have to say about, you know, what the elementary schools are dealing with.
Thank you so much, Kenzo. We really appreciate your insights on this and all your hard work for your students and for CTU and for the community. So yeah, thanks for that. We'll hear next from Rosa Esquivel, who is a member of the 25th Ward IPO, our neighbors just to the north. I'll say we've definitely taken a lot of inspiration from the work y'all have done up there. She's also a CPS parent and a member of the LSC at Benito Juarez Academy in Pilsen. So Rosa, please go ahead.
Thank you. Thank you so much, Michael. Thank you so much, everybody, for being here today. And I really appreciate this opportunity. And yes, I agree with a lot of what Dr. Howard said. I agree a lot with what Kenzo said. You know, I have the perspective of the mom, right? Like, and I have two kids that are attending CPS schools. They go to Andrew Jackson. I decided not to send my kids back to school based on many things, right? But mostly seeing that, like, the community of Pilsen, a little village, right? A lot of our communities are essential workers. So the numbers in our communities, like Dr. Howard said, they are really high. They're really high. I seen through Pilsen Alliance and with other groups in the community, we did a lot of mutual aid. So my experience is that we had families that we're talking on the phone with them, and they have lost almost 10 members in just one family due to COVID. So this information, I'm really thankful for Dr. Howard. You know, we've been having a lot of meetings with him in the community, you know, because a lot of the information that I learned is from him, right? Because I feel like I don't trust CPS. I don't trust their numbers because they have lied to me in the past. You know, I was one of the moms that was fighting to get an IEP for my son, and I had to fight 4 years for that, right? Which is something that I don't wish upon nobody, upon no parent, because it really damaged the self-esteem of my son, you know. So that's one of the reasons why I don't trust CPS when it comes to, like, the information they give to parents. And there's a lot of misconceptions when it comes to, yes, individual education plan. That's what it stands for, IEP. My son has a mild autism, and that was part of my fight with CPS in the past. And I did that all by myself. I didn't have nobody behind me. If I would have known, you know, like, different organizations, that would be so much easier. But anyways, going back to what has been happening in the schools, right? I feel like there's a lot of misconceptions when it comes to, like, the way CPS is portrayed. CPS and the mayor are portraying teachers, right? My sister is a teacher, so I know that working remotely is really hard. You know, my sister has to work Sundays, Saturdays, in the night, you know, because she has to work on a curriculum. She does extra tutoring for her the children that she teaches. So when people tell me, you know, like, oh, teachers don't want to go back because they don't want to work, that's not true. And that's a misconception that a lot of parents are being said, you know, they've been told that they don't want to work. That's not true. I seen it myself. I cannot even call my sister when she's teaching because she doesn't have time. She doesn't have time for anything else, you know. So I know that teachers are working really hard, extra hard, you know, because it's not the same when you doing, you know, the person to person. But at the same time, you know, I understand, you know, my sister had COVID, my mother had COVID, and it was really extremely stressful on the family. You know, it was really I was crying because not knowing what was going to happen to my sister or my mom, I was not eating well, I was not sleeping well, but most of the reasons why I decided to keep my kids at home is because I'm also immunocompromised. My husband is immunocompromised, so I understand completely, that teachers are human too, and that's what people need to understand. And when it comes to like the excuses that they've been using about like parents need to work, people need to understand our teachers are not babysitters, they're educators. I used to work for one of the biggest nonprofits for childcare, which is Illinois Action for Children, and I know that there is investment that it can go to this type of organizations in order for parents to have childcare, where there is a smaller groups of kids, that they have also teachers that, when you have a smaller groups, I trust it a little bit. I trust it better, because it might not be as how to say that, like the danger of contagious, of being contagious, that much, so there's solutions. There's other solutions that the city can use so parents can work, and where you have your children safely with the smaller groups, and really investing in that type of childcare, right? Smaller groups and stuff like that. Also, I want to talk a little bit about like what we did in the LSC at Benito Juarez together with the Youth of Pilsen Alliance, right? It was all about organizing, and coming up with the resolution, because we voted for the resolution not to reopen Benito Juarez. We did that by organizing the community and by bringing the youth and having a voice, that they can actually speak to the LSC. And actually, Dr. Howard was there in our LSC meeting as well, which I'm really thankful for, because I feel like that helped a lot with the vote and this resolution, because we had people that didn't want to vote or didn't want to, or they were saying, oh, we need to reopen. But when they heard that information, they completely changed their mind, So that's part of the work, as organizers, we have to kind of do the work of informing the people, right? Because I feel like a lot of parents, when it comes to about the reopening of the schools, there was a lot of confusion. There was a lot of misinformation coming from CPS and from the major, that when they are really hearing the facts, right? That's when they do a decision that is based on information that they have been given. So that's part of the work, that we've been doing in the 25th Ward. As in right now, I don't know how long do I have, but as in right now, we're starting to do the campaign for vaccines. We're working with the Alderman's office, with coalition in the 25th Ward to do a campaign, because there's also misinformation about the vaccines. So we want to make sure that that people in the community, especially those that don't have the information or the resources or access to internet, and that they don't speak the language, they don't speak English, they get this information about the vaccines and how can they register and where can they go, and when is their turn and all that stuff, So we want to we want to start this. We've been doing the work, but we're like, moving faster now. So yeah, so thank you very much for this opportunity and for letting me speak, and for inviting me.
Thank you so much, Rosa. We really appreciate your insights and all the work you've done for your neighbors in the Pilsen 25th Ward area. Thank you for joining us today. Next up, we'll hear from Katie Osgood. Katie Osgood is also a CTU member and a CPS teacher. She teaches special ed students, and she's also a member of CTU's executive board. So she's had a lot of experience with addressing the concerns of teachers and community members during this pandemic and during this period where people are learning and working from home. And we'll look forward to hearing her insights. Please, Katie, welcome to the panel.
Hey everyone, thank you so much for inviting me. Thanks to the 11th Ward IPO for having this discussion. I want to say a huge thank you to Dr. Ehrman for your expertise and just sharing the realities, because I know I personally, you see the news every day saying it's fine, our positivity rates are going down, we're at 2%, everything's fine. And after a while, you do start to be like, well, maybe it isn't so bad. Maybe things are getting better. And it just, we have to keep coming back to like, no, here's the truth. Here's what's actually happening in communities. So thank you for that. Big thank you to Kenzo, who is a fellow executive board member in CTU with me and longtime activist. So thanks to Kenzo, and a huge thank you to Rosa for your thoughts, because I'm a special education teacher, so I just want to have a huge shout out to our special education parents. They are the most militant, the most active, the most hardcore fighters for kids in our school system. So thank you for that. And I'm so sorry that you had to go through such a hard time getting those getting services for your kids that they deserve. It's not okay. Which I think speaks to, I want to kind of start with a little bit of what it's like on the ground, but also kind of like the context for like actual C2 members and people that are in the building. I am a special education teacher for elementary grades. I teach 1st through 3rd at Suter Montessori. And I am currently back in person. Our kids started coming back this past week. And we had a trickle of kids, like between 0 and 2 kids per class. Really, and again, all of this stems out of the fight that has been put on by the CTU, by SEIU, by parents, by community activists. And yeah, I want to speak first, kind of like Rosa was saying about that, having to fight for everything in this district. And I think it comes back to that trust issue. People that have been around CPS know not to trust this system. And I think that's especially true for Black and Brown families and communities. They have experienced the racism of the system. They have experienced the gaslighting and the constant attacks on their kids. I think many of us that have been around have even for the past 10 years or so, for example, and beyond, really since the inception of public education. But I know just within my career in CPS within the past 10 years, we had to go through the school closings debacle where they closed 50 schools. I talk about that as murdering school communities, because they just didn't care. They just did something that was extraordinarily harmful, and the whole time had rhetoric around this is what's best for kids, and this is what's best for Black communities, and all these, and so again, that trust issue. The special education fight is another one. In 2016, they just started systematically denying services to kids, which I'm sure is something, Rosa, that you were up against as you were trying to get these services. And so, we have seen how important it is to band together and, fight the system constantly. And this is just an extension of that. Only this time we're talking about actual life and death. We're talking about actual, sickness and death in our communities, in our families, in our the people that work in the schools, the workers. So just to give a little picture of what it's been like being back in the schools, I think what Dr. Ehrman told us has just been spot on. First of all, ventilation, that wasn't a thing CPS was even talking about before we brought it up. They were like, what, you can open the windows, what's the problem? And we were like, actually, you can't open the windows in a lot of classrooms, but we started fighting around the ventilation issues. They had I mean, they had a year when they could have been going into buildings and updating ventilation systems. They could have been doing massive repairs and updates throughout the district with these 100-plus-year-old buildings. They didn't do any of that. They sat there and did nothing. Even as money was slowly starting to roll in to do these types of things from the federal government through these stimulus packages, right? They chose not to do any of them, like any type of mass updates to our schools. And to this day, like I teach in the special education resource room part of the day, they didn't give me any type of ventilation. I don't have anything in there besides windows that I open and some fans that I put in the window. That's my ventilation right now. And so they just blatantly lied about the ventilation within schools. They told parents they'd already checked it. They told parents everything's fine, don't worry about it. And again, never let those third parties in to actually figure it out if it's safe or not. Still to this day, has not been done. I think they also said that they set up these health screeners every day before you go in the building. You have to fill out a health screener. But what CPS did was made it incredibly difficult for anyone to say no to any of the health screening questions, because if God forbid you say, hey, I do have a cough, it's mild, I do have, a few mild symptoms, hey, I did travel recently, it became a thing where they won't believe you and you will get punished. You will be disciplined as a worker if you were to fail that health screener. So it's not even doing the job that it says it can do. And the same thing for families. Families are being pressured through a number of different ways, one of which just being basic childcare, is to say no to just lie on these health screeners, to just say to just answer no to all the questions, regardless of the actual health, right? The other piece, of course, is the testing that Dr. Ehrman brought up. They are not doing any type of testing. And before we did our fight through CTU, they weren't going to do any testing. It wasn't even on their radar. That was not even something they were talking about. Now they're doing a little bit of testing with just the staff. They are not testing any children, as far as I know at this point. So, as we're opening up these buildings, they are not testing our kids to see who's got asymptomatic COVID. And we know there's plenty of kids out there and people out there that are coming into buildings, especially considering the community positivity rates where they're actually coming from. So that is still a huge issue. And they have no plan, by the way. We've asked multiple times to say, when are we going to get some testing for kids? What about our kids in cluster programs? What about our young kids, the pre-K students and the kids that have been there for a while? And CPS has no plan. They won't budge on that. And again, just the lack, I want to come back to the lack of staffing. CPS has created a plan that is so unsafe that I don't remember the numbers, maybe if someone else from CTU remembers, but I want to say it's a huge percentage of our membership now has either applied for accommodations for themselves or applied for accommodations for them because of other immunocompromised family members that they live with or are caretakers of. And so some schools are so understaffed. This past week when they were opening up to the K-5 kids, which is the first week they've been back since last March, they sent out all of their network people to all of the schools. We had all these random people in our school building all week that were there because CPS knows that they are completely understaffed and have no, forget about the nurses. Like, we don't have a nurse every day. That doesn't exist in most schools to this day, just as Dr. Ehrman said. They haven't even promised to get to that until like 2023. So we're not even, that doesn't exist. But this in terms of basic staffing, and especially once we start seeing cases, once we start seeing more pods quarantine. The other thing that I just kind of want to bring up about just on the ground, what it's like in our schools, is you get the feeling that the people in charge, Lori Lightfoot, these folks, I question whether they've ever been in a public school in their lives, because they do not understand how these systems work, right? Public schools are incredibly complex. We have a lot of mandates. If you're opening a public school, for example, special education, you have to provide services per a child's individual education plan. You have to. It's not negotiable. And by opening schools just like citywide, saying, everyone's going to open right now. And and all these services had to be like completely rearranged. We had to completely, clinicians, you know, oh, this person's coming back, but this person's not. So now you're going to see this kid, and now we're going to change who your sped teacher is. And it has been absolute chaos because we are still, you know, ELL services, special ed services, clinician services, all of these things have been just so completely disrupted. And also the idea of podding kids. Kids being in a pod where you can safely kind of contain. I think Rosa really brought this up in a really powerful way, saying about you need to have a small group of kids that you can control and make sure you can't do that in a public school. You just can't. There's people in and out all day. There's mixing of kids. It doesn't exist. So, you know, I think just this entire plan has been unsafe from the beginning. I want to very quickly end with speaking a little bit about our fight that I know many people on this call participated in and supported and showed solidarity with. So, and then kind of we can lead into a conversation with all of us about what are the next steps and what do we do to fight from here. As many of you know, we worked very hard. I mean, CPS's initial plan was to just open in the fall. Well, no, technically they never wanted to close, right? That was their plan in the beginning last fall. They were like, or last spring. They were like, we don't need to close. There's no problem. Schools are safe. It's fine. And then of course, you know, CTU fought. We were able to get the schools to close down in March. We honestly did think it was going to be like a short-term thing that we were going to, you know, we're going to get ourselves together somehow. Of course, a year later, we saw how the COVID response went nationwide, and it's no wonder that we aren't safe to reopen schools, right? That we're still in this context where everyone's doing their own thing, and there's no mitigations and there's no enforcement. You know, it was a horrible, horrible COVID response nationwide, and we're seeing that play out now in the schools. But again, you know, we fought back. They tried to reopen in the beginning of the school year, fought that off. They tried to reopen partially in the fall with just pre-K cluster, fought that off. They finally succeeded in January, bringing in pre-K and cluster. And then I think what we did see that we can learn from and you know, be grateful for was a really huge groundswell of action and activism that came out of, you know, people seeing how unsafe it was, and just really powerful rank and file work. A lot of folks, like just rank and file people, getting together and saying, what do we do? How do we stop this? This isn't safe. We've seen the conditions in the buildings. They don't have ventilation. They don't have testing. They don't have any of the things they're even telling people on the news that they have. We saw LSCs band together, the local school councils, like Rosa was saying, and just do some amazing work, kind of getting that out there. We saw a lot of local actions, all the teachers teaching outside, all of those things, car caravans. But we also saw a lot of retaliation amongst our members. And I know within my members at my school at Suter, we did an action outside. And we all were sitting there outside teaching in our winter coats and our masks and our signs and everything. And one of our teachers, you know, got retaliated against because a parent complained, saying she was telling us it's not safe. And so she had this whole discipline thing against her because of this, even though all of us were doing this. And it's like, how do you not have a conversation with your students when you're sitting there outside? That's the whole point of these actions, right? But CPS across the board has been doing a lot of discipline, a lot of trying to silence, a lot of just gaslighting and saying everything is fine. Yeah, so I mean, we saw a lot of that kind of local action. And then I just kind of want to come back to what Dr. Ehrman was saying about kind of our CTU leadership and what happened. I know from us on eBoard, we were getting reports back daily from our leadership, our officers, about what was happening. And honestly, in my opinion, is that we honestly did run out of steam. I think there's a number of reasons why that happened. Like truly, Kenzo spoke to the demoralization and the exhaustion that comes from these fights. And I think that there is a place to talk about just how exhausting these things are. But I think part of the problem is, one, internally, you need to really allow for rank and file leadership, so it's not all on the shoulders of just a handful of your officers, right? You can't do this work. It is exhausting. It is, I mean, having to sit at the bargaining table is no doubt. I sat on the bargaining table with Kenzo and 50 plus other folks during the 2019 strike, and these people they're insane. They just say the most ridiculous things, and it makes no sense, and it's very frustrating. It's a very frustrating process. But I think internally we did need to do more work at opening up that space so that it wasn't so much on just a handful of people. But also externally, there's only so much one union can do. There's only so much that, there are limitations that we come up against when we try and do that. And I really do think that organizations like IPOs in different communities can play a role, and political organizations that are out there can play a role in thinking about how do we open up these fights so that it is broader, so that it is more of a mass movement. So it's not just here's one fighting union. Here's, we sometimes can loop in SEIU with us, but sometimes not. I think how do we broaden that through the broader labor movement and beyond to unorganized workers as well, and just communities, and sharing that burden so that it is not just the same folks having to do these fights. I mean, for me, as being in CTU for the past 10 years or whatever, however long it's been, this was our fifth almost strike. We've had 3 strikes that actually happened. One that didn't happen in 2016, and now this one that didn't happen in 2021. So that's a lot of action just for one union, right? So just talking about how to broaden that. And I think that kind of leads us into the conversation of what do we do now that CTU does have this deal, that the schools are opening up. How do we continue that fight back? So I'll stop there.
Thank you. Sorry about that. A little bit of technical difficulties on my side, but thank you, Katie, for sharing that, for sharing your insights on that, and especially for the additional context of how the vote to accept the tentative offer from CPS went within. So we appreciate it. Real quick, before we begin the Q&A, Dr. Ehrman asked for a little bit of extra time to talk a little bit about the broader political context. Dr. Ehrman, please go ahead. Let's keep it to just a couple minutes. I'm really looking forward to hearing your insight on that too.
Yeah, so I just want to thank Katie and all the other, Keslo and all the other CTU people here. In no way did I mean to belittle the stress that, looking from the outside in seemed enormous and must have been 100 times more so on all of you and continues to be so. I happened to be at the right place in the right time, and was part of the contract negotiating and strike committee at the longest doctor strike in United States history by far, 18 days, 1975. At Cook County Hospital. There's a movie about this, which isn't very good, but Kartemkin has it. You can get it. Our lives were threatened every day, et cetera, et cetera. Hopefully that's not happening to you. So I think the broader context is multiple. I put a lot of stuff in the chat. And I think this is a great opportunity as well as a terrible time. Every terrible time presents a great opportunity. And I think it's a great opportunity to, first and foremost, develop a set of strategy and tactics, which are both long-term and short-term, to make a break from the biggest yoke on our backs since 1936. And that is when the united front of the Communist Party, the Socialist Party, what was left of the IWW, other groups, Trotskyist groups, were all working together and then decided on orders from Stalin and the Comintern to develop a popular front, which meant embracing the Democratic Party in being stuck in a paradigm that we are all still suffering from, over 80 years later. And what I mean by that is that those of you who are familiar with the writings and the practice of Samir Amin, Martha Honegger, both of whom passed to the next world a couple of years ago. They were very clear, as were other people historically, who were both intellectuals, trained intellectuals and leaders of revolutions, that the struggle must primarily be outside the parliamentary context. This in no way means that we do not have a strategy of what to do about electoral politics, whether that's 23 months from now with the next mayoral and aldermanic elections or anything else. We absolutely must have a strategy and tactics of how to deal with bourgeois, democracy in the United States. Lenin wrote extensively about this. If you have never read any of Lenin's work, I would highly encourage you to do so. I put one of the links in there. Of course, he's not the only person who wrote on this. And I think that has a lot to do with this particular struggle. What we're proposing in the people's response is to don't think first and foremost of how many aldermen we can get to vote for our budget proposal, which some of you have read, and others, I'll try to put it in the chat before we leave. Think first and foremost, working with people like Rosa, working with your sisters and brothers in CTU and any other formations, the IPO in the 11th Ward, of how we can get people to stand together on what I think is a winnable demand. It's not going to be easy. And that is right now, keep every high school closed for education and open them up for these COVID sanctuaries for vaccination, testing, resources, contact tracing for everyone, the teachers and staff, if that's where they want to go, if they live in the neighborhood, but certainly the parents and everyone else. As we know, the vaccine actual numbers are going to go way up in terms of availability over the next couple months. So we have a great opportunity here. It's a way to take all the incredible work that those of you in CTU did over the last year and to concretize it into at least one tactic that I think is winnable. The last thing I'll say about this is that the left, unfortunately, has been incredibly weak on the issue here, one of the main issues, and that is the direct attack by the capitalist state all over the world on public sector and the public sector unions in particular. The big four locally or in states, of course, are education, health, housing, and public transit. But then we know that the Veterans Administration and the postal workers are also huge. And this is, and I'll finish with this is both a race and class issue. It's not just CPS that has had a whitening of teachers. It's been true in the Department of Health and a lot of other areas where mostly older African Americans who literally fought and died to get public service jobs beginning in World War II have now or are retiring in huge numbers, and they're not being replaced. And what we have to do is to take the leadership that CTU has done locally and nationally and put it on steroids from the rank and file, from core and whatever other formations there are, and say we have to have a strategy of becoming proactive, of fighting to regain the public sector on our terms. And that includes, of course, abolishing the police and getting rid of bail and jails. Thank you.
Thank you for that, Dr. Ehrman. Really appreciate that, that additional political context. You've been organizing here on the left for a long time, and your insights are definitely valuable for those of us who are maybe new to organizing and radical organizing. We have, we'll aim for about 20 minutes for a Q&A session here, and I'll ask the panelists to please try to keep your responses to approximately 60 to 90 seconds each, just to make sure we can get in as many questions and answers as possible. And I'll also note that Rosa, one of our panelists, did have to step off. She had a prior commitment. So I just want to, again, say thanks to Rosa for being here today and for sharing her insight as a CPS parent and an LSC member. Also, we, just for this Q&A session, if you would like to ask a question, feel free to use the raise hand function in Zoom, or if you're not familiar with that function, or if you'd prefer to just type your question up and have one of us read it out, just put your question in the chat. So like I said, anybody who'd like to ask a question, please use the raise hand function or put your question here in the chat. I have, we see a question from Sarah. Thank you, Sarah. Questions for panelists. How do we improve remote learning, and how do we help families feel less pressure to return to school buildings? How do we reclaim education as a public good? And what do we think the new normal will look like over the next few years? I paraphrase a little. Also, that's a lot of questions, but again, like I said, please try to keep your responses brief. Any of the panelists feel free to jump in whenever you have something to say on this.
Yeah, I can speak a little bit to that. I think these are really great questions, Sarah. Thank you for them. The idea of improving remote learning, I think, is one of the fronts that we need to really fight on right now. We lost a lot of headway in terms of the public messaging around remote learning. You know, CPS and Lightfoot, and just nationally, they did a really good job, you know, of making it seem like this is an equity issue to bring kids back in person, right? They really did switch that conversation on us. And we do have to fight back on it, that remote learning is certainly not perfect, but this is a safety issue first and foremost and forever. So it's not about, you know, it's not about whether or not kids, you know, this pandemic is doing that. It's not the fact that schools are closed, right? So, yeah, how do we improve remote learning? I think one of the big things is that we partner with parent groups that are doing that work. We know, like Raise Your Hand, for example, is working on that, which is a very active parent group. But I do think we need to kind of actively seek out more parents to push the district, because they have been adamant that we must meet these thresholds in terms of how long kids must be on the screen time. And I really do believe that there are ways to reimagine what remote learning can look like, project-based, not having to be in front of a screen for the whole time. The idea of, first of all, simultaneous learning, they are asking, I'm sure as many of you know, they're asking us teachers to do simultaneous teaching, where we're literally teaching the kids on the computer and the kids in front of us at the same time, and it's making it worse for all children. And I think we have to highlight how that makes it so much worse. I know for myself, I bought like special headphones that are Bluetooth and like had only like, you know, one earpiece, so I could run around and talk to kids, but also talk to these kids on here. And it doesn't work. Like it just doesn't work. After having done this for the past week, I'm like, well, this is a joke. And I only have like maybe a hand, like I had 2 kids for 2 days in front of me. That was the extent of it. And even that was like, my remote kids are not getting what they need, because I'm like, you guys hold on, I have to go help over here. And me running around the school and like, oh, your device isn't working, or oh, you need a headphone set, you know, it just so much, it just doesn't work. So I think that's a huge piece. How do we improve remote learning, cut down on the time and improve the quality? I mean, that's ultimately what it is, right? And absolutely, I think that we have to have some time limits when it comes to screen time. Our kids are exhausted. It is exhausting being in front of a computer all day, and that's true of adults, and for our little ones it's especially true. So and then just real quick, I think the other piece is like, how do we get that message out there to parents to have kids not come back? I think that's a big thing that we can do right now to keep our buildings safer, because you know we lost the fight in keeping schools closed, right? We lost it. And how do we push for safety in this moment? We have to win the debate for our families to say, yeah, keep your kids home. It is not yet safe. And a big part of that is fighting to have like the ability to tell the truth to families. Like, again, CPS retaliated so hard against the folks that directly told parents, hey, this is my opinion on what's actually happening in the schools. Hey, it's not safe. So we have to protect those folks, allow those messages to get out there. And then I really do think LSCs play a huge role here too. I know our LSC, we held a meeting for our parents. We just like made a Zoom meeting at Suter and invited parents to come off of school time. And parents were just like gushing about how grateful they were, that because we just told them what we actually felt. And we did it as as an entire staff. It wasn't just one or two people. It was all of us decided and organized. So, and we said, we don't think it's safe. We think the quality of the education is going to go down. We think, we think that this is a bad plan. Here's what it actually looks like in the school. Here's what the actual day is going to be like for your child under this plan. And saying those things to parents directly changed. I mean, we had maybe half our school signed up to come back, and at the end, maybe 5 to 10% actually showed because we did that organizing work.
Thank you for that, Katie. I've as a non-parent, I have heard similar concerns about the quality of the simultaneous in-person and remote learning from other parents, including those of you who know Miguel Batista from the 28th Ward. He shared some thoughts of his as a CPS parent, and his own son was learning from home while the teacher was trying to simultaneously teach in-person and remote students. So just the challenges that parents face are definitely, they're overlapping with the challenges the teachers are seeing. Next question will come from Anna. Anna, please go ahead and ask the question for the panel.
Hi, yeah. So I had a sort of a question around vaccines. I saw Rosa was saying she doesn't want to send her kids back until they're vaccinated. My understanding was the vaccine's only been approved for people ages 12 and up. And I've heard from people who are proponents of going back that ages 10 and under are less likely to catch it and less likely to spread it. But we've heard from Dr. Ehrman that may not be the case. But I'm curious, is it still 12 and up only for vaccines, and sort of what is the plan to go back for the people who can't get those vaccines?
Oh yeah, thank you, Anna. Those are all great questions. So just to clarify, so the Pfizer vaccine is 16 years old and above. That includes my 16-year-old grandson at Juarez. The Moderna and Johnson & Johnson vaccine are only 18 years old and above. So that excludes most CPS high school students. There is now some testing going on of younger kids, and we hope that by June 1st, if not sooner, the age will be lowered to 12 and then lower than that. I honestly don't know, and I don't even think Dr. Anthony Fauci knows how soon that's going to happen, but hopefully by June 1st. And so we know from multiple studies that the propaganda that comes out of the mouth of the government, both the past Trump government and now this government, about it's safe to go back to school, including the CDC director, who I hope you know is a very nice person, a well-respected, deservedly so, infectious disease doctor who never spent 1 minute in public health before she became CDC director. How many people here would have chosen somebody, even if there wasn't a COVID pandemic, who never spent 1 minute in public health? So what does this mean? It means that we have good, solid data that children under 10 to 12, which is what the World Health Organization and the rest of us believe is the cutoff, do get less sick than people who are older. That includes children over 12 and adolescents. However, their both rates of infection and ability to transmit this disease are equal or greater. I want to say that one more time, equal or greater than older kids. The reason for this is because they are less sick. It's easier for them to transmit it because people, they don't know, and their parents don't know, and the teachers don't know, and the staff and their fellow students don't know that they're sick. So that's the real dangerous thing here. And that's why it's really important to do this testing once a week. I just want to respond to one thing that Katie said, and I hope we can meet offline about this, Katie, and with anybody else. I put my cell phone and email in there. You may have lost the battle about elementary schools being reopened, but I think the war is long and it's not over with. And I would really hope that all of you who are activists, whether you're part of CORE or not part of CORE, CTUs, whether you're a steward or I guess you call yourself delegates, really take up this issue, at least to discuss about high schools not reopening. I think that there's a huge push from the bottom now within CTU to the leadership and from the parents to not open high schools I think this is winnable.
Thank you, Dr. Ehrman, for that additional context and for the inspiring call. We appreciate it very much. We have Stack is open, I believe. If anybody would like to ask a question, please use the raise your hand function. I know scrolling back, I believe I saw that Stuart had a question. Stu, would you like to ask anything? Your question, I believe, was around the political context and how to, some big picture questions. Stu, if you'd like to go ahead, please.
Yeah, sure, Dr. Ehrman. Thank you so much. Really appreciate the just kind of discussion of the neoliberal framing. I think it's just kind of really discussion of, I mean, you're right. It's kind of like about 3 generations of, war on the public sphere, I think, and kind of privatizing of the commons for private profits. So how do we just kind of make allow the public to kind of see just more clearly what's going on? Because there's just a propaganda warfare that, is very effective at kind of taking in, I would say, some legitimate concerns and then like reframing them and diverting the energy away from kind of class solidarity and dismantling, these systems of privilege and oppression that are really just really ubiquitous. And, public sector, I think union membership, of course, being at like, lows, I think four times lower. I think our peak rates, just all of this is just kind of endemic and I think representative of just all these patterns. So how do we kind of get into public awareness and just better kind of communicate to families? I'm a teacher as well, so I just, how do we communicate just what's going on better? Because I feel like there's a big disconnect.
So I really thank you for your comment and question, and thank you for being a teacher. There's a good reason why teachers and nurses are literally the 2 most respected workers out there in the public sphere for 340 million of us. So here's my quick answer. Number 1, just to clarify, actually public sector union membership has held steady for most of the last 3 decades. It's around 35%, and it's actually slightly growing because of the great work of your union and all the sister unions that you've inspired across this. This is not just inspiring teachers. This is for people to continue the fight in the public sector. The private sector union membership has dropped precipitously since the beginning of neoliberalism to about 6%. As you may know, 3 years ago in 2018, maybe it was 2017, for the first time in history, the actual numbers of public sector union members surpassed private sector union members. So it's about 16 million to 15 million. So I think the way to do this is for first and foremost, for those of you in CTU, to work not only with your SEIU colleagues inside, but the public sector workers that we know. This is not going to come primarily from the top. I'm just being honest with you. If you take the example of SEIU, they're never going to criticize Pritzker at this point. So I think you have to work from the bottom and work with the parents, the community organizations, the IPOs like the ones that are present, and also make this a huge job thing. This is about public service jobs that pay better, have benefits, have union membership. So I'll give you one example and then I'll shut up. So there's one agency in the state that's done things the right way around COVID. And that's my sister, Dr. Rachel Rubin. She's not really my sister, but she is politically, who's the head of the Cook County Department of Public Health. She and I talked a lot at the beginning of COVID, and she convinced Preckwinkle to make all of their contact tracers, public employees, $21 an hour, AFSCME members, full benefits. That's the only place that's done things right. So there's ways to do this, and there's ways to combat people's anti-public feeling. It's got to separate Lightfoot, Pritzker, and Biden from the public sector. And so the last thing is, if you have not seen the PBS film in January 2020 on the Rainbow Coalition, please watch it. It's free and online, because that's what we have to do. We have to rebuild a Rainbow Coalition from the bottom up that puts public sector first. And having known Fred Hampton since he was 15 and I was 16, that was a huge thing. The Panthers were never about like, we're going to do this on our own. We have to fight to do this. And that's why the CDPH clinics existed in the first place. So.
Thank you for that response, Dr. Ehrman, and thank you, Stu, for an excellent question. I think there's a lot to learn from the organizers that came before us, especially here in Chicago. There's a long, deep history of radical organizing, obviously going back to the Rainbow Coalition and the Black Panthers, and even going back further than that to radical activity in the 1930s and before. So thank you for that. We'll ask for, if anybody has one last question they'd like to ask, if you'd like to put it in the chat or raise your hand. Just give a moment for people to consider their questions. Seeing, I don't believe we see any additional questions here. So with that, I'll call this panel to a close. Would like to thank again Dr. Ehrman for his presence, thank Katie for her presence, and Kenzo for his presence, and of course Rosa, who left a few minutes ago. Thanks to the panelists, thanks to everybody who asked us excellent questions, and thanks to the 11th Ward IPO members who put together this panel so we could all share and discuss what's been going on in CPS with the reopening. Definitely get involved if you live in a neighborhood that has an independent political organization. The 25th Ward IPO, the 11th Ward IPO, 33rd Ward Working Families, United Families of the 35th Ward. A lot of IPOs have sprung up in the last few years, so definitely get involved in an IPO in your community. If you are a union member, if you'd like to be a union member, join your rank and file caucus, join your, talk to your fellow workers and your coworkers about how to organize within your union. If you are a parent, get involved with parent organizing and make sure that you know your children's teachers and make sure that you're involved in your community. I'll give just one last moment. If anybody on the panel would like to plug anything, any organizations you're working with or any other appearances you're doing, please go ahead and do some quick plugs here at the end.
Well, I would just invite everyone to our weekly People's Response meetings at 5 o'clock to 7 o'clock. It's the same time every Wednesday. If you are not able to make those, please contact me offline. There's a lot of other people in the People's Response beside Howard Ehrman. We have 26 endorsing organizations. I can't remember if 11th Ward IPO is one of them, but if not, we'd love to have you look at our 5-point program. And also our latest Take the Vaccine to the People proposal. So thank you very much for inviting me and look forward to working with you in the future.
Kenzo, go ahead.
So yeah, tonight at 6 p.m. you could tune into, if you go to classtime.gg, I'm having a show called Meet the Left where we're going to be talking to some activists and organizers about the weekly news and from a leftist perspective. So it's classtime.gg. Thanks.
Thank you, Kenzo. And that will do it. Thank you again for everybody for coming, and hope everybody has a wonderful afternoon.